So let us study a few tissue salts and see how you'll understand them. So there are three ways I would recommend. The first is you study the physiologic chemical action of a salt. The second is you study the general action. And third, you study the keynotes. All right. I think let's take up the questions at the end now. Let's go to a few remedies and see how we all understand. Maybe that will clear things up for you all. So the first remedy I'm going to start with is the most simple, most commonly used one, which is Magnesia Phos. So if you all have your books with you, please go to MagPhos. Let us read through it. So if you all remember the constituents of cells, MagPhos is a part of nerves, muscles, bones, and even the brain cell. It is Magnesia Phos is on page number 98 of the Schussler's tissue salts. I'm reading the physiologico-chemical data. It is a constituent of muscles, nerves, bones, brain, the spine, and sperms, teeth, and also blood corpuscles. A disturbance of its molecular motion causes cramps, pains, and paralysis. Schussler says that the action of Magnesia Phos is the reverse of that of iron. By functional disturbance of the molecules of iron, the muscular fibers relax. So what this means is if there is a deficiency of iron in the body, if iron is not being transferred well from the cell to the blood or vice versa, your fibers will be relaxed. But through the functional disturbances of magnesium, they contract. Hence, it is the remedy for cramps, convulsions, and other nervous phenomena. Simple. What he says is pretty straightforward. That if there is a deficiency of magnesium, that if there is deficiency in the movement of magnesium, it is not necessary that magnesium is lacking in the body, but that it is not being transferred from the blood plasma to the cells and back from the cells to the blood plasma. That is what he means. Okay. So that is how it causes cramps, pains, and paralysis. So this is the short and simple physiologico-chemical data of Magnesia Phos. So we learned two things. We learned one thing about Magnesia Phos, that it causes contractions. The second is a deficiency of iron causes relaxation of the system. So you will notice that a lot of people who've got iron deficiency or iron deficiency anemia complain of weak muscles, flabby muscles, relaxed muscles, that whatever you do, I'm not gaining strength in my body. You will notice that when you look at an iron patient who is deficient in iron. All right, just remember these. After that, we are reading the general action of Magnesia Phos. Diseases having their seat in the nerve fiber cells or in the terminal bulbs of the nerves, in the muscles or in the muscular tissue itself are cured by this remedy. So nerve fibers, nerve endings, and muscles as a whole or the muscle tissue itself are cured by this remedy. It corresponds to pain of all kinds with the exception of burning pains. It is especially related to cramping pains, which we all know. Pains which are darting, spasmodic in character, boring, lightning-like, accompanied by a constrictive feeling. They are often changing in locality and are relieved by warmth and pressure. It is purely antispasmodic and hence is curative in cramps, spasms of the glottis, tetanus, epilepsy, spasmodic retention of the urine, paralysis agitans, etc. It is best adapted to lean, thin, emaciated persons of a highly nervous organization and prefers light complexion and the right side of the body. Cold in general favors its action exceedingly, whereas heat and pressure interfere with it. Hence, the patient is relieved by these. Attacks are often attended with great prostration and sometimes with profuse sweat. The magnesia phos patient is languid, tired, exhausted, unable to sit up, whether he is suffering from acute or chronic affections. So, as we have read through this, we've got a brief idea of what MAGFOS does for the body and what its deficiency can do. So, the application mainly is in all areas where spasm is created, whether it be in the nerves or the muscles. All right. So, moving forward, what are the keynotes? This is a very rare application that I've done for MagFOS. So in the beginning, if you all paid attention, in the physiological chemical data, we read that it is a good component of even the spermatozoa. So case examples where you can easily use this is dysmenorrhea, abdominal colic, asthmatic attack. Now, dysmenorrhea, it is very, very, very useful as an SOS. Usually, people tend to take a painkiller or ketonov, which is very effective at reducing pain, which is an allopathic medication. So, dysmenorrhea with a lot of blood flow, or even when the flow doesn't start and there are a lot of cramps in the stomach. So, how I have prescribed in these cases is I tell them that usually 2 days before your date, you start taking MAGFOS in water. The proportion I give is this: in half a liter of water, you put in 10 tablets and you keep consuming that water through the day. And 99% of the times, they complain of a pain-free and normal cycle. Whatever problem it is, whether it's a PCOD, whether it's endometriosis, or whether it's just a heavy flow with a bulky uterus, even if there are fibroids, it has always worked for me. Giving MAGFOS in water, consume that water throughout the day. 500 ml, about 10 tablets to be dissolved in it and to be taken sip by sip through the day. Take it, most of your hormonal troubles will be solved. Yes, hot water is of course better, but in India, people find it a little difficult to keep taking hot water. They tend to be more acidic. I'll answer Dr. Janvi's question that they are not actually 2 drugs at a time. We'll discuss that in the end. Abdominal colic, of course, be it a colic of whatever nature, whether it's just trapped gas in the bowel loops, whether it's even a gallstone colic, whether it's an initial appendicitis, whether it's just, very difficult motions also, wherever the peristalsis of the intestines is faulty. One thing always remember, spasms are created in muscular fibers where the fibers are circular in nature. So all the tubes in the body, even the respiratory tracts, the digestive tracts, the muscle fibers, where there are circular and voluntary muscle fibers, will respond very, very, very well to MAGFOS. All right. And that is the same principle that you use in asthmatic attacks. So hot water and MAGFOS is more suited to asthmatic attacks because it tends to open up the air passage. Don't treat it as a remedy. It is just to tide over that acute episode. It is not a remedy. It is just helping you maintain the flexibility of your tubes, that is the respiratory or the digestive tubes. All right. So keep in mind, all hollow things can contract. That's it. That's the easiest thing to remember. That is how you will keep using MAGFOS again and again.
Hello and namaste from Mumbai. I'm very, very excited to share with you that this December we are launching the advanced course on classical homeopathy. So all the homeopaths out there, students, interns, early practitioners, students anywhere, this is the thing you need to join. It's a weekend course, online course. You can sit at home and learn. In today's times, the world has been online. We are going to be talking about 100 Polycrest remedies, also rare remedies, organon, repertorisation techniques, advanced level of case taking. Also, we'll also talk about how to use mother tinctures, organ remedies, biochemics. It's going to be one of its kind. Homeopaths across the world are going to be teaching also in this, and I'm working on the content of it very, very closely with the best minds in homeopathy. So I really want every single one of you to join us, be a revolution in this field. I'm also going to give a lot of homework to all of you, so be ready for a lot of training sessions with me. Also, there is an early bird offer, so if you register earlier, you will get it at a major discounted rate. And if you already attended my last course, you'll also in this early bird offer, you'll also get the last course, that is the 6-month classical homeopathy course, as a guest access. We are going to increase it for 6 months, so you'll also attend the last course plus this course. So it's going to be close to about 200 hours of classical homeopathy at your fingertips for the next 7-8 months. It's going to be one of its kind. So if you want to be a genuinely good homeopath and a clinician, this 200 hours will take you to the next level. So forget everything else. Forget the Netflix, forget the Amazon Prime, forget the movies, forget the stories. Classical homeopathy at its best. Just email on the below email ID, register, be a part of revolution. Every single one of you listening, hand on heart, join us.